The human heart is a remarkable organ, tirelessly pumping blood throughout our bodies. This vital function relies on 4 valves acting like doors that ensure blood flows in the right direction. One such door is the mitral valve, nestled between the left atrium and left ventricle. When this valve becomes narrowed, a condition known as mitral stenosis arises, hindering the smooth passage of blood. Imagine a garden hose with a kink in the middle. Water flow is significantly reduced, right? Similarly, in mitral stenosis, the narrowed mitral valve restricts blood flow from the left atrium to the left ventricle, putting strain on the heart and impacting circulation. This obstruction forces the heart to work harder, potentially leading to fatigue, shortness of breath, and other complications. Understanding mitral stenosis is crucial as it is a serious condition, but with proper diagnosis and treatment, individuals can live full and active lives. Mitral stenosis often progresses slowly, with symptoms sometimes taking years to surface. This silent progression makes early detection all the more critical. Regular checkups and being attuned to our bodies are paramount in recognizing the subtle cues of this heart condition. In the upcoming sections, we will delve deeper into the causes, symptoms, diagnosis, and treatment of mitral stenosis, empowering you with the knowledge to navigate this complex condition. To effectively address mitral stenosis, it's essential to understand what causes this narrowing of the heart's valve. Rheumatic heart disease, an inflammatory condition triggered by an untreated strep infection, often takes center stage as the primary culprit behind mitral stenosis. The body's immune response, intended to fight the infection, mistakenly attacks the heart valves, leading to scarring and thickening that obstructs blood flow. While rheumatic heart disease is a major contributor, it is not the sole cause of mitral stenosis. Another significant factor is mitral annular calcification, a degenerative process that involves calcium deposits accumulating around the mitral valve. Picture a pipe gradually accumulating mineral deposits, constricting the flow of water. Similarly, these calcium deposits stiffen the valve and hinder its ability to open and close properly, impeding blood flow. Beyond these primary causes, other less common factors can contribute to mitral stenosis. Congenital heart defects, where the valve doesn't form correctly from birth, can cause narrowing. Rare instances involve tumors, blood clots, or radiation therapy as contributing factors to mitral stenosis. Recognizing these diverse causes is key for healthcare providers to accurately diagnose and tailor treatment plans for each individual's unique situation. Understanding the root cause of a patient's mitral stenosis allows for a more targeted approach to management. While rheumatic heart disease requires ongoing monitoring for recurrence, mitral annular calcification might necessitate different interventions. By identifying the source of the problem, medical professionals can personalize treatment strategies for optimal outcomes. Mitral stenosis often whispers its presence through subtle signs, with many individuals unaware of their condition until it advances. One of the most common and telling symptoms is exertional dyspnea, shortness of breath during physical activity. Imagine trying to breathe through a straw while running. The restricted airflow mirrors the experience of someone with mitral stenosis. As the narrowed valve restricts blood flow, the lungs struggle to oxygenate the blood effectively, leading to breathlessness, especially during exertion. Fatigue, a persistent feeling of tiredness and lack of energy, is another frequent companion of mitral stenosis. Because the heart constantly works harder to pump blood through the constricted valve, the body's energy reserves become depleted, leading to persistent fatigue. This fatigue can impact daily activities, making even simple tasks feel exhausting. As the condition progresses, additional symptoms may arise, signaling a worsening of the stenosis. These can include a rapid or irregular heartbeat, often described as palpitations. Swelling in the legs, ankles, or feet, medically termed edema, can occur due to fluid buildup from the heart's struggle to pump efficiently. In severe cases, individuals might cough up blood, a sign of bleeding in the lungs caused by increased pressure in the pulmonary veins. Recognizing these symptoms is paramount in seeking timely medical intervention. While some symptoms, like fatigue, can be attributed to various factors, experiencing shortness of breath with minimal exertion should always raise a red flag. Early detection and treatment are crucial in managing mitral stenosis and preventing potentially life-threatening complications. As mitral stenosis progresses, the heart, in its tireless effort to maintain blood flow, undergoes significant changes. The left atrium, the chamber responsible for receiving oxygen-rich blood from the lungs, faces the brunt of the narrowed valve's impact. Imagine a balloon being constantly inflated and deflated with more force than usual. It's likely to stretch and weaken over time. Similarly, the left atrium, forced to work harder to push blood through the constricted mitral valve, gradually enlarges. This enlargement, while a testament to the heart's resilience, is not without consequences. The stretched walls of the left atrium become more prone to developing an irregular heart rhythm known as atrial fibrillation, AFib. In AFib, the upper chambers of the heart quiver instead of beating effectively, increasing the risk of blood clots forming within the heart. These blood clots pose a serious threat, as they can dislodge, travel through the bloodstream, and potentially block an artery in the brain, leading to a stroke. Furthermore, the enlarged left atrium, despite its best efforts, may not fully compensate for the restricted blood flow. This can lead to a buildup of pressure in the lungs, a condition known as pulmonary hypertension, causing shortness of breath, fatigue, and even heart failure. The impact of mitral stenosis extends beyond the heart itself, affecting various bodily systems. Understanding these potential consequences underscores the importance of early detection and treatment to prevent irreversible damage and maintain overall health and well-being. Section 5. Telltale signs from facial hues to heart murmurs. While symptoms like shortness of breath and fatigue provide crucial clues, physical examination reveals additional telltale signs of mitral stenosis. One such sign is malar flush, a reddish or purplish discoloration of the cheeks, often described as a mitral facies. This characteristic flush results from the heart's struggle to pump blood efficiently, leading to dilated blood vessels in the face. Imagine blowing up a balloon. As it expands, the surface stretches, making the color appear lighter. Similarly, the dilated blood vessels under the skin cause the reddish hue associated with malar flush. Another important indicator lies in the heart's own symphony, the sounds it produces with each beat. A stethoscope, acting as a listening device, allows healthcare providers to detect abnormalities in these sounds. In mitral stenosis, a distinct heart murmur often arises. Imagine the sound of water rushing through a narrowed pipe. The turbulent flow creates a whooshing sound. Similarly, the restricted blood flow through the narrowed mitral valve creates a rumbling murmur, usually heard during diastole, the period of heart muscle relaxation. The characteristics of this murmur, its timing, intensity, and location, provide valuable insights into the severity of the stenosis. Healthcare providers, like skilled conductors interpreting a musical score, analyze these subtle variations in heart sounds to assess the condition's progression and guide treatment decisions. Recognizing these physical signs, coupled with a thorough evaluation of symptoms, forms a crucial part of diagnosing and managing mitral stenosis effectively. Section 6. Unveiling the silent threat. Diagnosing mitral stenosis. Diagnosing mitral stenosis involves a multifaceted approach, employing various tools and techniques to unveil this often silent threat. The journey begins with a comprehensive medical history and physical exam, where the doctor meticulously listens to the heart and lungs for any telltale signs, like the characteristic heart murmur. This initial assessment guides the path toward confirming the diagnosis and determining its severity. An electrocardiogram, or ECG, a simple and painless test that records the heart's electrical activity, serves as the next step. Imagine an orchestra. The ECG acts as the conductor's score, revealing the rhythm and coordination of the heart's contractions. While an ECG might not directly diagnose mitral stenosis, it can detect associated abnormalities like left atrial enlargement or atrial fibrillation, providing valuable clues. Chest X-rays, or CXR, offer a visual representation of the heart and lungs, allowing healthcare providers to assess their size and shape. Think of a blueprint highlighting the structure of a building. CXR provides a similar snapshot of the chest cavity. An enlarged heart or changes in the pulmonary veins on a CXR can suggest the presence of mitral stenosis. The gold standard for diagnosing mitral stenosis lies in echocardiography, a non-invasive ultrasound of the heart. Imagine a sonar system mapping the ocean floor. Echocardiography uses sound waves to create detailed images of the heart's structure and function. This imaging modality allows healthcare providers to visualize the mitral valve directly, assess the degree of narrowing, and evaluate the blood flow through the valve. Section 7. Restoring the flow treatment options for a healthier heart. Once diagnosed, the approach to treating mitral stenosis centers around managing symptoms, slowing disease progression, and improving heart function. Treatment plans are tailored to individual needs, considering factors like age, overall health, and the severity of the stenosis. In mild cases where symptoms are minimal or absent, a watchful waiting approach might be adopted, involving regular monitoring for any changes in the condition. For individuals experiencing symptoms, medications play a crucial role in managing the effects of mitral stenosis. Diuretics, often referred to as water pills, help the body eliminate excess fluid, reducing the workload on the heart and alleviating symptoms like edema. Beta blockers and calcium channel blockers work by relaxing the heart muscle, slowing the heart rate, and improving blood flow. In cases where medications alone prove insufficient, more invasive procedures become necessary to address the narrowed valve directly. Balloon valvuloplasty emerges as a minimally invasive option, offering a beacon of hope for suitable candidates. Imagine a tiny balloon being inflated inside a collapsed pipe, widening the passage. Balloon valvuloplasty employs a similar principle. A catheter with a balloon at its tip is guided to the narrowed mitral valve. The balloon is then inflated to stretch the valve and improve blood flow. For severe cases or when valvuloplasty is not feasible, valve replacement surgery remains the gold standard treatment. This involves surgically replacing the damaged mitral valve with a new valve, either mechanical or biological. While mechanical valves offer longevity, they require lifelong anticoagulation therapy to prevent blood clot formation. Biological valves, often made from animal tissue, carry a lower risk of clotting but might require replacement sooner than mechanical valves. Section 8. A Future of Hope. Advancements in mitral stenosis care. The landscape of mitral stenosis treatment continues to evolve, offering renewed hope for individuals battling this heart condition. Advancements in technology and surgical techniques pave the way for safer, less invasive procedures with faster recovery times. Transcatheter mitral valve replacement, or TMVR, a minimally invasive alternative to open-heart surgery, is gaining traction as a viable option for select patients. This groundbreaking procedure involves implanting a new mitral valve through a catheter inserted into a vein in the groin, eliminating the need for open-heart surgery. TMVR holds immense promise, especially for individuals considered high risk for traditional surgery, providing a new lease on life. Furthermore, ongoing research focuses on developing novel therapies, including percutaneous mitral valve repair techniques. These minimally invasive approaches aim to repair the damaged valve without the need for open-heart surgery, potentially revolutionizing mitral stenosis treatment. As our understanding of the disease progresses and technology advances, the future holds immense potential for innovative treatment options, offering individuals with mitral stenosis a brighter and healthier tomorrow.